Hey folks, welcome to Chapter 9. We'll be doing a little overview of vitamins in general, but we're focusing in Chapter 9 on the fat-soluble vitamins. So we'll take a look at what do they do? What are the functions of fat-soluble vitamins? Where do we get them? What happens if we don't get enough of them? What happens if we get too much of them? And how are fat-soluble vitamins affected by different health conditions, such as cystic fibrosis and other health conditions that affect the digestive tract, which is, of course, where we will be digesting and absorbing our vitamins. So vitamins were first defined by the fantastically named Polish chemist Casimir Funk. What a name. So vita for necessary for life, and amine because it contains nitrogen, but later it was found that not all vitamins contain nitrogen. So the name was adjusted a little bit from vitamine to vitamin. Mild change, but just to reduce the stress on the amine element. So as that isn't part of the definition anymore. How do we know that we've discovered all the vitamins? Well, we know this because we are able to have people thrive and grow on formulas, not food, but lab-created formulas, nutrition formulas, that have, of course, what we've covered in the first couple chapters, right? They have proteins in the form of amino acids, essential fatty acids for the fats, and some simple carbohydrates. And they have all the vitamins and minerals. And people are able to survive and even thrive and grow, like infants born prematurely, and also people recovering from various disease states in which their digestive function is really affected. So they take these liquid nutrition formulas, and if there were still vitamins or minerals to be discovered, those people would not thrive. So we know we have pretty much covered that territory. We understand, maybe not precisely exactly every detail, but we understand what vitamins and minerals are necessary for health. So part of that definition we just covered. The fact that vitamins are something that the body needs to obtain outside the body, right? Essential, like we talked about essential fatty acids a few chapters ago, right? So in some cases we do make some vitamins in the body, but we don't consistently make enough to just survive on what we make in the body. So we have to obtain most vitamins in the greater quantity from foods, and a lack of a vitamin will cause a deficiency symptom or disorder. And we'll talk about these per each individual vitamin, but that's just part of the definition. And that when that deficiency is eliminated, when the vitamin is consumed in enough quantity, the symptom or disorder disappears. So vitamins are kind of micronutrient, right? Vitamins and minerals are micronutrients. The carbohydrates, fats, and proteins are the macronutrients. They have some things in common, that we have to obtain them from outside sources, and that there are consequences for not obtaining them, or not obtaining them in sufficient quantities. And while they're organic, like the macronutrients, there are some differences. So we don't burn them up for energy, so they don't have calories, and they're in very, very small amounts. So we can think about this example with a slice of bread. Slice of bread has a very, very tiny fraction that has vitamins in it. So we're talking about 1.48 milligrams of the weight of bread. And the bread is about 28 grams. That's a pretty massive difference, right? So 28,000 micrograms, or milligrams, sorry. That gives you an idea of the scale. So vitamins and minerals are present in very small amounts. In the past, most vitamins and foods were often expressed as international units, IUs. But that has gone a bit out of fashion in modern nutrition, and now we're using more the precise metric measurement, so milligrams or micrograms. Mostly what we'll be thinking about is what is the RDA for a specific vitamin and how do we meet that RDA. So we'll be focusing on the really practical element. There are two basic categories of vitamins. So one is fat-soluble vitamins, which we'll look at here on this slide. Those are vitamins that do not like being in watery environments, hydrophobic, right? They are found and they do their functioning, their work, in the lipid parts of the body. And they're also found in the lipid parts, the fatty parts of foods. And there are only 4 fat-soluble vitamins. So in terms of memorization, if it's not A, D, E, or K, it's a water-soluble vitamin. Fat-soluble vitamins, deficiency is a little less of an issue because we store them for a long time. But on the flip side, toxicity is a bit more of an issue because we can accumulate them in greater quantities and we don't eliminate them quite as fast and easily as water-soluble vitamins. Water-soluble vitamins are hydrophilic, so water-soluble vitamins like to be in the watery environments of the body. That's where they do their work, and they're also in the watery parts of food. So that's all the B vitamins and vitamin C. And so thiamine, riboflavin, niacin, B6, pantothenic acid, folate, biotin, B12, vitamin C. There is a little bit more issue with deficiency because we don't store water-soluble vitamins for a long time, but it's less likely to build up toxic amounts. Oh, and by the way, B12 we do store for longer amounts, so a little bit of an exception there. When we take in too much of water-soluble vitamins, we can eliminate the excess in the urine. And there are a couple other vitamin-like compounds. Choline, carnitine, lipoic acid. Those are also water-soluble. A, D, E, and K, the fat-soluble vitamins, that's what we're looking at today. And they do have a couple different forms, active, inactive forms, a couple of variations, slight chemical variations of the vitamins. So you'll see using a few different names as we talk about them this chapter. So same thing looking here at water-soluble vitamins, more than one name, right? So we have thiamine, which is also called B1, vitamin C, also called ascorbic acid, and some vitamins have more than one form. So you'll see that, for instance, with B12 has 2 forms, B3 has a couple forms. The vitamin-like substances will be covered in the next chapter, so I'll leave that for chapter 10, but at least here you have the names to get a little bit familiar with. Vitamins have a wide variety of functions in the body, so we'll talk about these on an individual basis, but overall, a couple brief things. For instance, mentioned here, donating electrons. That's how antioxidants function. You have vitamins involved in bone health. The B vitamins primarily involved in energy metabolism, so getting those calories out of the macronutrients. You have vitamins involved in red blood cell formation, in the immune function, in growth and development, in a wide variety of functions in the body. One of the most well-known nutrition terms out there in kind of common media sources we hear about all the time is antioxidants. So we'll talk about which specific vitamins act as antioxidants, and why that's important. In order to understand what an antioxidant is, we first have to understand what a free radical is. And in normal body biochemistry, there are all sorts of reactions that take place. And sometimes a compound in the body will lose an electron. And when it loses an electron, it's considered oxidized. And that an oxidation reaction forms what is called a free radical. So it's a substance with an unpaired electron. It's reactive and unstable, and then can steal an electron from another molecule in the body and cause chain reactions, essentially. So an antioxidant can stabilize a free radical by donating an electron. Well, most free radicals are generated by natural activity in the body. It is thought that toxins in the environment, pollution, environmental toxins, for instance, working in a polluted factory or drinking polluted water, that is theorized that can also create free radicals in the body. And the process of oxidation, free radical activity, is thought to be part of what creates loss of organ function and general deterioration of the body that we associate with aging. And one of the ways we can limit the damage that free radicals do is by eating a healthy diet that is rich in antioxidants. And we'll talk about some specific antioxidants and sources shortly, but you have fat-soluble ones and water-soluble ones. So for instance, vitamin E is a fat-soluble vitamin, and that would work in the fatty tissues of the body. This is a useful summary slide that groups different vitamins according to what their general functions are. So, for instance, the B vitamins are really important in energy metabolism, and you see them all there. Vitamin K, blood clotting, antioxidant defense, so vitamin E, C, and some carotenoids, which would be precursors of vitamin A. And you can pore over the rest of these to get a good picture of what general categories the vitamins fall in. Although we'll go into more detail on the specific ones here shortly. So where do vitamins come from? Well, in general, from food. So that can be plant source food, could be animal food, of course, fungi, meaning, for most of us that would be mushrooms that also have some vitamins in it. Bacteria, that's more lab sources where you can, certain bacteria can be manipulated to create certain vitamins, so synthetic vitamins. We'll talk about some of the differences. It's interesting, there are a lot of different studies done on how vitamins influence health, and Oftentimes, synthetic vitamins don't have the same effect as vitamins found naturally in food. But we'll talk about that here in a bit. When I teach these introduction to nutrition courses, every course always has some assignments where you're doing a nutrition analysis, looking at what your day's diet, how it matches up to the recommendations for vitamins and minerals. And sometimes students are concerned, oh my God, I only got 68% of vitamin E. Well, you can be perfectly healthy and not get 100% of vitamin every day, of every vitamin. In fact, that would be pretty unusual if you did. There are ebbs and flows in diets, and people eat different things. And some days they, eat more of a certain vitamin or mineral, and some days less. And that's perfectly normal and healthy. And in my experience in general, most healthy people eating a well balanced diet don't need any sort of a supplement. Where supplements have come in really useful is in clinical nutrition. And for instance, when I have patients who have very limited diets because they are experiencing side effects from medications that lower their appetite, and then supplemental sources of vitamins and minerals can be extremely useful. This ties into bioavailability. So when people are really sick, sometimes their digestive function decreases, and they're not able to absorb as much of micronutrients as a healthy person can. So having healthy digestive function makes a big difference. Also, for instance, people who had their gallbladder removed, they'll have more difficulty digesting fat-soluble vitamins because they have more difficulty digesting fats, right? Sources of the vitamins as well. So we'll talk about some specific examples, but some vitamins are more bioavailable in some foods than other foods, and supplements versus foods. And in general, when there's a deficiency, the body upregulates intake of certain micronutrients. So there can be some adjustments the body makes. So in chapter 3, we discussed nutrient enrichment and fortification, but worth mentioning again, this process started right around 120 years ago, specifically as the Industrial Revolution made it easy to refine grains. There were some common nutrient deficiencies that happened, and government stepped in to insist on enrichment so that we didn't have widespread nutrient deficiencies. And if you think about, for instance, whole wheat versus white flour, there's a really significant difference in quite a few vitamins and minerals. And that's a classic example where you'll have that white flour, which doesn't have the germ or the bran. It will be enriched with several, though not all, the vitamins and minerals that it has lost. Well, we always come back to the same place in the body when we're talking about absorption, right? So we have to digest the food to release the vitamins, and that process starts in the mouth and, of course, continues in the stomach and the small intestine. But the actual absorption, most of that happens in the small intestine, which has been the case the whole semester, right? The small intestine is where we do the majority of absorbing nutrients in the body. So the fat-soluble vitamins, which we're focusing on today, we do need some fat in the diet in order to absorb those vitamins. That's usually not an issue in most well-balanced diets. If anything, the American diet tends to be pretty high in fat. But if you have, for instance, something like a salad with a fat-free salad dressing, well, yeah, you are going to miss out on absorbing some of the fat-soluble vitamins in that salad. So even just, touch of olive oil or something, doesn't have to be drowned in olive oil, but a couple grams of fat will really help the absorption of those fat-soluble vitamins. Well, as mentioned earlier, a well-balanced diet will generally satisfy our micronutrient needs. Now, where you can have some problems is with a not nutritious diet, a diet, for instance, the American diet often lacks in fruits and vegetables, so we tend to be low in some of our micronutrients. And if there are digestive disorders, so I mentioned gallbladder being removed, which would of course really affect the absorption of fat-soluble vitamins, but also different kinds of bariatric surgery that will impact absorption of micronutrients, and other kinds of illnesses that affect the digestive tract. And that's where supplements can come in really handy with medical nutrition therapy. Yeah, so a couple of common categories of people that are at risk for vitamin deficiencies, and I saw this working clinically a lot. Alcoholics, also drug users, they just tend to not eat nutritious diets. Alcohol also increases the need for certain B vitamins, so you kind of get two issues there. Some people are not eating much. They may be drinking their calories, right? Drinking a great deal of alcohol, not eating a lot, and not making great choices when they eat. Older adults, because of digestive issues, including decreased stomach acidity and sometimes medication interactions that can affect vitamin digestion. Hospitalization always is risky for developing vitamin deficiencies. And the main reason being nutrition tends to go down. Appetite tends to go down with different disease states and medication interactions. Vegetarian diets in general can be super healthy, but when people go on restricted diets, including vegan and vegetarian diets, and don't think about the nutrition first, there can be vitamin deficiencies. And then, of course, including eating disorders. So, again, a group of people who are not eating well-balanced diets for whatever reasons. Sometimes we tend to think more of a good thing is better, but that really is not true. The body likes to drive down the middle of the road, and meaning that oftentimes the symptoms of excess vitamins are really similar to the symptoms of vitamin deficiencies. And we'll talk about a couple specific examples. But I saw this often working clinically, people taking too much supplements and causing themselves harm. Some good tips here around preserving vitamin content in foods. And I'll tend to focus on fruits and vegetables since that's the area where Americans are deficient in. And one thing I always tell my patients is, well, fresh is the best. If you don't do fresh, consider frozen fruits and vegetables, because they are frozen shortly after harvest and their micronutrient content remains quite high. So two good techniques for preserving vitamin content are steaming and stir frying. Both of them involve minimal nutrient losses. So the four fat-soluble vitamins are grouped together because they all include a hydrocarbon chain, a little bit similar to the fatty acids we looked at a couple chapters ago. And of course, this makes them compatible and soluble with fats. This chart just provides a good overview of what we'll be looking at over the next many slides here. And here we have a good overview of some of the sources of the fat-soluble vitamins that we're looking at today. All right, jumping into vitamin A, we're looking at a couple different forms of vitamin A. And although retinol and the retinol esters and other related forms, those are only found in animal food. So you can think vitamin A for animals. But plant foods contain a lot of carotenoids. And these are yellow and orange pigments that the body, well, some of them, the body can convert some of these pigments into biologically active retinoid. Vitamin A is crucial for the development and functioning of all cells in the body, but in particular, the production and maintenance of epithelial cells, the cells that form the protective tissues that line the body. So skin and linings of digestive, respiratory, reproductive tracts, that's all epithelial cells, epithelial tissues. This is just one example of epithelial cells, and a young immature epithelial cell with the sufficient amount of vitamin A, it can grow into a mature, complete epithelial cell. One of the key areas of vitamin A function is with vision, so in the eye. The retina, which is the light-sensitive area inside your eye, contains rods and cones. And retinol, you can think of a little bit like the fuel for your eye to be able to see, especially in dimly lit conditions. So vitamin A deficiency will reduce vision accuracy, especially in darkness. This slide looks at the details of how vision works. The rods they're pulling out retinol from the bloodstream to convert to retinol, so retinol to retinol. And when we have less light, the retinol binds to a protein called opsin to form rhodopsin. In this dark environment, we'll need this rhodopsin, which will then allow us to be able to see. So when we have less vitamin A in the body, we will not be able to see in low light well. So food sources of vitamin A are pretty widespread, considerably higher in animal foods, but we do convert some of the preformed vitamin A, the plant pigments like beta carotene, into vitamin A. So you can see we can convert plant sources of carotenoids, plant pigments, into vitamin A, but the efficiency is not great. So on average, the body gets about 1 microgram of retinol from every 12 micrograms of beta carotene in food. So we do get some, not a lot. And interestingly, those plant pigments act kind of like pigments in your body as well. So I would have students do this in my nutrition classes, but take a picture of your hands and then for a couple days eat a really carotene rich diet. So pumpkin, sweet potato, those are great foods to do it. Papaya works too. Carrots, super great. And you'll actually start to see a little bit of an orange tint on in your skin. And actually, a lot of health and beauty magazines will promote eating a carotenoid-rich diet because it gives kind of a healthy glow to the skin. So as we get that vitamin A into our body, it's a lot like dietary fats in that it is transported in chylomicrons. Remember the chylomicrons, those lipoproteins that float around through our lymph tissue. And that's how the vitamin A gets around in the body. So these other carotenoids related to beta carotene but not convertible into vitamin A have some vitamin-like functions. So also super healthy, really good antioxidants. Lycopene, for instance, has been studied for its potential to reduce the incidence of prostate problems and prostate cancer. So a chart here that looks at some of the quantities in common food sources of vitamin A. By the way, in this nutrition textbook, you'll notice often liver, and the liver being the, could say, the chemical factory of the body. That's where we store a lot of vitamins and minerals, and it tends to be a really good source of quite a few micronutrients. The average American diet does get enough vitamin A, and that's due to we eat a pretty animal protein rich diet. So the only groups at risk for vitamin A deficiency in the U.S. Preschool children not eating enough vegetables. They're also thinking of small, relatively low appetite, and they're growing, and so they have a pretty good need for vitamin A. Outside of the USA, there's a lot of vitamin A deficiency, and if any of you get into kind of global health work, that's more of a concern. But in the US, less so. People on very low-fat diets because of the issue with absorption, and you'll see low-income folks, on a lot of these at-risk groups for deficiency because they just don't get a well-balanced diet often. And of course, we mentioned some issues with older adults, alcoholism, and a couple of disease states. One of the areas we can see the impact of vitamin A deficiency is in the eye. So when epithelial cells do not have enough vitamin A, they overproduce keratin, which is a protein that's found in epithelial tissues. And the epithelial cells that line the inner eyelids secrete mucus. This helps keep the cornea moist and clean. So with someone that has a chronic vitamin A deficiency, we're not talking about a couple days here and there, but over a long period of time, weeks and months and years, these cells accumulate excess keratin, become hardened, and can no longer produce mucus and keep the eye moist and clean. During pregnancy, vitamin A deficiency can lead to quite a few adverse health outcomes for both the mother and the baby. So it's important for fetal eye health. Vitamin A is also key to developing the immature organs of the fetus and the skeletal development. Remember, vitamin A is involved in cell reproduction. However, pregnant women should not take vitamin A supplements because when taken excess during pregnancy, vitamin A can actually increase the amount of birth defects. Because vitamin A is a fat-soluble vitamin, we do have to take the risks of toxicity seriously. You can't actually get an overload of vitamin A from plant sources because the body will simply stop converting the beta carotene into vitamin A. But from animal sources, it's rare. More it's common when taking supplements, and you can see some of these symptoms are quite serious, and especially really important again to have caution during pregnancy. Well, I mentioned carotenemia earlier, and yeah, that's harmless because the body isn't actually converting excess beta carotene into vitamin A. It will just convert as needed. And actually, a little bit of carotenemia is probably a decent sign of a healthy diet. No big surprise here that in observational studies, diets rich in fruits and vegetables tend to have a lower risk of some cancers, heart disease, and age-related macular degeneration, which is the leading cause of blindness in the U.S. Okay, moving on to our second fat-soluble vitamin, and we'll start out by mentioning vitamin D deficiency. So in childhood, that can lead to rickets, which is a kind of like osteoporosis for children. It's weak bones. Bones are soft and can be malformed. Leg bones tend to curve a bit under the weight of carrying the rest of the body, but it can also affect a child's joints, rib cage, pelvis, and it can be treated by simply increasing the amount of vitamin D in the diet. And of course, we get a lot of vitamin D from sunlight exposure. So looking here at a couple forms of vitamin D, and it's worth mentioning that vitamin D is unusual for vitamins in several ways. One, we'll talk about it a bit, but acts a little bit more like a hormone at times than a more typical vitamin. And it's also really unique that we can get enough vitamin D when we are exposed to the sun's ultraviolet rays. So we don't need to get a sunburn or anything like that, but just enough that we can get that slight change of color of the skin, and that does provide enough vitamin D. Although there are also several plant and food forms. Because vitamin D is a very powerful agent in the body, really acting like a hormone at times, the body carefully controls vitamin D. And the active, biologically active form of vitamin D is made in the kidneys. So we don't actually intake active vitamin D. We intake it in inactive forms, and then our kidneys can convert it to active vitamin D. Whether that vitamin D comes from ultraviolet, from our skin making vitamin D from the sun, or from food, it travels to the liver, and in the liver we store some vitamin D, and as needed our kidneys will turn vitamin D into the most biologically active form, which is the 1,25 dihydroxy vitamin D, or it's also called calcitriol. And the body's very careful about how much calcitriol it activates because it has a quite significant impact. So it travels to our digestive tract and sends a signal, hey, we need to increase absorption of calcium. and phosphorus. It travels to our kidneys and says we need to reduce excretion of calcium, and it can travel to our bones and say, hey, we need to release some calcium and phosphate. So when blood levels of vitamin D, when blood levels of calcium drop, we activate vitamin D in our kidneys in order to increase the amount of vitamin D in our body and keep levels of calcium and phosphate in homeostasis where we need them. This slide repeats a few of the things I mentioned in the last slide, but also mentions the role of the parathyroid hormone. So when the levels of calcium in our blood are low, it signals the bones to release calcium and stimulates kidneys to increase vitamin D production and decrease calcium elimination in urine. So again, this is about homeostasis of these really important minerals in our body. This is just another way of looking at everything we talked about in the last couple slides. So while we think of vitamin D primarily in relation to bone health, it does have a couple other roles in the body, including roles in the immune system and in regulation of neuromuscular function and in inflammation. And there have been studies that show that getting sufficient vitamin D can help with several chronic disease states. I worked with kidney disease patients for 6 years. I worked in dialysis clinics, and we very carefully monitored levels of vitamin D in the blood. And as far as I know, these are the only patients that regularly receive supplementation of calcitriol. So because calcitriol is so potent, calcitriol is not sold in stores. You can buy vitamin D, but not that 125, not that most active form. But kidney patients often do need to take that calcitriol, and we monitor to make sure the levels don't go too high and the levels don't go too low, so that we can maintain healthy bones and as well as immune function. Whenever we have students do nutrition analysis, they always have very, very low levels of vitamin D, and occasionally students come to me alarmed, oh my God, my levels of vitamin D are so low. And that's really common because there aren't many food sources of vitamin D. This isn't a problem for most people if people are outside and get some sun on a regular basis. Where this is an issue is often with folks with darker pigmentation, because it takes longer for their skin to convert vitamin D, especially if they live in northern latitudes where there's just less sunlight, or they live in areas where a lot of skyscrapers and there just isn't much direct sunlight. So think of like Detroit or something. Northern latitude and a big urban city where perhaps not much sunlight gets through even on a sunny day. Here, just reiterating a couple of the points mentioned in the last few slides. And we can think of here, again, most of the USA is fairly northern latitude, and especially in the winter, it can be easy to become vitamin D deficient if you're staying inside and avoiding the cold weather, and if every time you go out in the cold you're so bundled up that very little sun hits your skin. Much less of an issue, of course, in the summer. And some of this is also due to lifestyle. Like, are you indoors playing video games all summer? Well, you're not going to get a whole lot of vitamin D, right? I mentioned this connection between skin color and vitamin D a little bit earlier. I put a link in here to just a really wonderful TED Talk about the relationship between different skin colors and vitamin D and actually the evolution of skin color. I highly recommend it if you're interested in this topic. So we do have a bit of an issue in the US with vitamin D deficiency, and a lot of this has to do with changing lifestyles over the years. There's just so much technology, and so many people are spending more time indoors than they used to. And if we think about the changing work patterns as well as compared to 100 years ago, where likely more people were spending more time outdoors working in agriculture and maybe walking or bicycling to work. We really live in a pretty indoor oriented society, and that does have some consequences. Well, we mentioned a few of these issues before, but rickets is the deficiency disease in children for vitamin D deficiency, and in adults, same thing, but it's called osteomalacia, which means soft bones. Now, since vitamin D is a fat-soluble vitamin, we do store it for a long time, meaning especially with supplementation, there are risks of toxicity. And in those cases, you can get too much calcium deposited in soft tissues, in, for instance, kidneys, heart, blood vessels, and this can really deteriorate the functioning of those vessels and organs, and can be very, very toxic. Vitamin E has 8 different forms, and we'll talk about vitamin E in general, but we'll also mention a couple of the differences with a few of these forms as we go on. So vitamin E, is the major antioxidant in fatty parts of our tissue. So in addition to that, it also has roles in maintaining nervous tissue and in immune function. So if we look at our cell membranes, which, if you remember, the cell membranes have the phospholipids, and on the part of the phospholipids that face in, that's the fat-loving part, right? Those are fatty acids. And when we have free radicals damage the fatty acids, we need vitamin E in order to donate the electron and stabilize the cell membrane. If you look at some of these sources of vitamin E in the diet, you're looking at foods that are pretty high in fat, right? So nuts and seeds get about 70 or so percent of their calories from fat, and that's where the vitamin E is hanging out. And in particular also in plant oils, and of course that's going to be entirely fat, right? So those are a couple of the good sources of vitamin E. So looking at a couple more food sources in detail and how the amount in a typical serving compares to the recommended daily allowance for adults. One little thing to point out here, look at wheat germs. So the wheat germ, it's that little part of the whole wheat grain that is removed when we refine whole wheat into white flour. So another example of why it's really important to try to eat more whole foods rather than refined foods. And this slide is reinforcing that same message, that vitamin E can be lost in food processing. And it's also susceptible to destruction by exposure to oxygen, interaction with metals, light, high temperatures. So while deficiency is rare, many Americans don't meet the RDA, so you could call that kind of a subclinical deficiency. It's not so deficient that you get a lot of symptoms, but not getting the ideal amount for health. And if we look at some of the causes of vitamin E deficiency, similar to what we mentioned with vitamin D, people who have poor digestive health can also end up with a vitamin E deficiency. So diseases that interfere with fat absorption, again, could be one example of those causes. And some of the deficiency symptoms listed there below, but can be pretty severe. But of course, this has to be quite long-term and substantial vitamin D deficiency in order to cause these issues. Now, with vitamin E deficiency having some potentially very serious consequences, there have been a lot of studies on using vitamin E supplements to prevent or treat different chronic disease states. But in general, most of these studies have shown that supplemental vitamin E doesn't have the same kind of effect as high dietary amounts of vitamin E. In fact, some of these studies have shown worsening of health with vitamin E supplements. So kind of a mixed bag with the supplements, and as seems to always be the case in nutrition, getting your micronutrients from food sources is always the safest bet. So some of the epidemiological studies from a few decades ago indicated that populations who had naturally rich vitamin E diets, so from food sources, had lower risk of heart disease than groups that didn't eat much vitamin E in the diet. And then, of course, as I mentioned earlier, there were attempts to recreate that with supplements, but the results have been mixed at best. All right, let's chat about our last fat-soluble vitamins. So vitamin K, which was named K because of its role in coagulation, which we'll talk about here in a second. And I know you're thinking coagulation, that starts with a C, but in Danish, it's a very similar word, coagulation, pronounced similarly, but spelled with a K. 3 different forms of vitamin K listed below: plants, animals, and synthetic. Vitamin K is also unique in that we produce quite a bit of vitamin K in our large intestine. So similar to the other fat-soluble vitamins, we need to have some dietary fat to get the vitamin K absorbed in the small intestine. And we also just have to have good digestive health. We have to be producing enough bile, our pancreas has to be producing enough fat digesting enzymes. In general, that's not an issue with most people. And another thing to mention is we have to have good digestive health in our large intestine, since that's where we produce about 10% of our vitamin K. And so, for instance, something like taking a long dose of antibiotics, that can impact vitamin K production because we've wiped out some of that good bacteria in our gut. We mentioned vitamin K as being important for blood coagulation, which we'll look at in the next slide. But it's also very important for bone health, for bone formation, and preventing too much bone breakdown, and has roles with regulating calcium in the body. So if we look here at this graphic, we see a woman cutting vegetables, and she cuts her finger, and that will initiate a process where there'll be inactive platelets and inactive clotting factors in the blood. They become activated, and in order for that process to happen, we need vitamin K. So that is part of the process to make the prothrombin and several other blood clotting factors. Looking at food sources of vitamin K, look at what comes up again. Liver, right? Liver just has kind of everything. And some other really healthy foods. So green leafy vegetables, kale and greens, cabbage, spinach, have quite a bit of vitamin K in them. Looking here at a couple of different sources for vitamin K, and I can tell you one place where this comes into clinical nutrition practice is when patients are placed on blood thinners like warfarin. We have to go over with the patient vitamin K and food contents of vitamin K, because vitamin K can actually increase clotting time, and when you're on the blood thinner, you're trying to decrease clotting time, so it can kind of work against the impact of the medication. So as mentioned before, there is no RDA for vitamin K, but there is an AI. And vitamin K deficiency is often can happen when there's a long course of antibiotics, or if you're on very low fat diets. And if you think of why are antibiotics connected, it's because we're wiping out that good bacteria in the large intestine and small intestine, but in the large intestine where we create, where the bacteria, healthy bacteria, will normally produce a fair amount of vitamin K. And then also, infants, newborns, are often given a supplemental dose of vitamin K at birth because their digestive tracts haven't developed yet enough to produce vitamin K. Yes, as mentioned previously, vitamin K is recommended for newborns by the American Academy of Pediatrics, though in the last couple of years there have been people suggesting that they don't give their newborns vitamin K, and this is probably mostly on the level of internet rumors. I would trust the American Academy of Pediatrics on this. More research is needed on this topic, but it is known that vitamin K is critical for maintaining bone strength. So we're going to chat about a related condition, cystic fibrosis. Cystic fibrosis, it's estimated that over 10 million Americans are carriers of the faulty cystic fibrosis gene. So the presence of this gene leads to the overproduction of thick and sticky mucus that can impact negatively the lungs, pancreas, liver, intestines, sinuses, and sex organs. Cystic fibrosis is the most common inherited respiratory disease in the West, and the incidence is about 1 per 3,000 live births. And it is possible for families who have a history of cystic fibrosis, they can undergo prenatal testing to assess their risk of having a child with cystic fibrosis in the future. Here are some of the signs and symptoms of cystic fibrosis. In the U.S., all newborns are screened for cystic fibrosis during the first several days of life. And Most children with cystic fibrosis are diagnosed by the time that they're 2 years old. So there also can be people that are diagnosed when they're teenagers or younger adults, but those are individuals who have a milder form of the disease. So it might not be as obvious early on, but over time it can be detected. Treatment for cystic fibrosis includes airway clearance, diet, medications, and sometimes surgery. There is also medical nutrition therapy for cystic fibrosis, which we'll get into here in the next couple slides. Since there is sometimes a reduction in the amount of enzymes produced by the pancreas, some people with cystic fibrosis take essentially a supplement that mimics, that contains the same pancreatic enzymes, and they take that with any food. There's also a lot of concern about the digestion and absorption of fat-soluble vitamins, so hence the recommendations about eating higher fat meals. Since cystic fibrosis does impact the ability of the body to digest and absorb fat-soluble vitamins, deficiencies are an issue. There is research ongoing which supplements are useful, which are not. Vitamin A supplementation, it's right now up in the air whether that's useful or not, but vitamin D supplementation is more common, and sometimes the recommendation to spend more time in the sun to generate vitamin D, though as long as the patient's not on antibiotics, because sometimes the patients on antibiotics from lung infections are also can be part of cystic fibrosis, and some antibiotics can increase sensitivity to sunlight. Vitamin E is often supplemented in cystic fibrosis patients. Vitamin K, that is that's more of a debate whether that how much should be given and if that's wise to give vitamin K. Congrats, you made it to the end. Make sure you read the chapter and take notes. As always, the audio narration is just a good way to review the material. You do need to read the book, folks. Thanks.